Hi, everyone. Today, Laura and I will be providing you with a demonstration of a COVID-19 case investigation. I will be playing the role of interviewer, and Laura will be playing the role of the interviewee, named Jennifer Thomas here. Before we get started, I'd like to point out that I have a blank Word document here that's open to take note of any response that does not have a field within the case investigation form in CommCare. Or really, I can put anything in here that I feel is important and therefore should be brought to the attention of the county health department. When the interview has been completed and you have registered contacts to the case, please do enter any notes that you take in this Word document into the patient notes field at the top of the case investigation form. Again, these can be really useful for the county health department to get up to speed quickly on the case and highlight anything that you feel is important and noteworthy. After you've added these notes, do make sure that you scroll all the way down, hit submit, and then also make sure that you unassign the case from yourself. Again, that's if you have completed the interview, added contacts, and added a complete and thorough patient note. That said, unless you have anything you want to add, Lara, is there anything that you feel we should mention, or are we
I think we're
all set to go?
good to go.
Okay, excellent. Thank you. Hello, my name is Eason, and I am calling from the New York State Department of Health on behalf of Chemung County Health Department. Could I please speak with Jennifer Thomas?
This is she.
Hi, Jennifer. I'm calling to collect some follow-up information regarding a recent lab test result. Before we begin, I just want to confirm your date of birth. Could you please share that with me?
Yes, sure. It's 5/7/75.
Thank you. And have you been informed of your test result by your healthcare provider?
Yes, I have.
Okay, thank you. And I know this might be a difficult or confusing time for you, so please feel free to use me as a resource if you have any questions. I would also like to Yep, of course. I'd also like to preface our discussion by emphasizing that all the information that we discuss will be kept confidential. It will be shared only with public health officials on a need-to-know basis. The information will only be used to, essentially the goal here is to stop the spread of COVID-19 and also to ensure that you receive any assistance you might need. That said, is it okay if we continue?
Sure, yes.
Yep, okay. So to follow up on your diagnosis that you know that you've tested positive for COVID, I'm going to ask you a series of questions about a variety of topics to get all the information needed to best determine how we can help you and how to prevent infection in others. Therefore, the questions I will ask will cover, I guess, some basic information about you, as well as your symptoms and any exposures you would have had before falling ill, as well as any contacts you may have had while you were infectious. Additionally, before we proceed, I would like to also verify that your preferred language is English and that you have enough time for us to talk. Okay. And so now is a good time to talk? You're alone? Okay, perfect.
Yeah.
Thank you.
Yeah, sure.
Okay. So I just want to verify that the number I am calling you on, 334-523-4467, is the best way to reach you.
Yes, that is. That's my cell.
Okay, thank you. And I also have a work or alternate line here. I just want to verify that with you, and I apologize beforehand. I'm going to read back a lot of numbers and information to you just to make sure that I am recording the right things. So I have an alternate number of 607-443-4001.
Yes, that's correct. That's my landline.
Got it. Thank you. And do you have an email address that you would be willing to share with us?
Sure. It's jthomas4@gmail.com.
Okay. And that was jthomas4@gmail.com. No punctuation, no symbols?
Nope, that's it.
Okay, thank you. And what gender would you identify as?
Female.
Okay. And what race would you identify as?
White.
Okay. And would that be Hispanic or non-Hispanic? Or prefer not to answer?
Non-Hispanic. Non-Hispanic.
Thank you. Okay. And I just want to verify the address that we have as 152 Astor Drive, Horseheads, New York.
Yes, that's correct.
Okay, thank you. And that is located in Chemung County, correct?
Yes.
Okay, thank you. So next I have a couple of questions about your healthcare provider. First and foremost, do you have a healthcare provider? And if so, would you be willing to share their name and contact information with me?
Yeah, sure. I have to look up the contact information, but my provider's name is Jennifer Holly. And let's see if I can get that for you. Her phone number is 607-795-5100.
Thank you. And would you by chance happen to have an email address for Jennifer Holly on hand? If not, don't worry about it.
Yeah, I don't. Okay. We don't have an email for her.
Okay, no worries. And how would you describe Jennifer Holly's affiliation? What provider or hospital are they tied to?
They are tied to Guthrie Big Flats.
Okay. And I'm sorry, would you be able to spell that out for me? I apologize.
Sure. Guthrie, and then it's just Big Flats with an S at the end.
Okay. Flats. Okay. Thank you so much.
Sure.
So as far as your emergency contact goes, do you have a preference for a relative or a close friend, a spouse possibly? And if so, would you be willing to share their information with me? Oh, excellent.
Yeah, you can put down my husband, Kevin Thomas.
Okay. And do they reside in the same address as you, 152 Astor Drive?
Yes.
Drive, okay. And that was located in Horseheads, New York, correct?
Yep.
Okay, thank you. And what is the best way, if needed, for someone to reach Kevin?
I can give you his cell phone. That's 907-663-5690.
Okay, that was 907-663-5690.
Yes.
Okay, thank you. And would you be willing to share an email address for Kevin?
Yes, sure. Let me just also look that up real quick. Okay, that's KJT605@gmail.com.
Okay, thank you. Okay, so I have a few questions next about your living situation. But first, I want to go over, in essence, what isolation is and what it means. Since you are positive for COVID-19, it is very important that you stay at home and distance yourself from others so that you don't pass on the infection to anyone else. So you will be required to isolate, and that means to stay at home until you are fever-free for 3 days and at least 10 days have passed since your symptoms first began. You will also be required to monitor your temperature and symptoms for all the days you are in isolation. Being in isolation is a legal requirement, and your local health department will issue an isolation order to you. So now I'm going to discuss how you should self-isolate to protect others in the household from exposure. And I'm going to read through a series of bullets here. They're very information dense, so if you would like to hear anything again, please let me know. Or if you have any questions, please feel free to cut me off, and I am happy to help. So please stay in one room away from others as much as possible. It is particularly important to stay away from people who are at higher risk of serious illness, such as those who have underlying medical conditions, are immunosuppressed, are over 60 years of age, or are pregnant. We can discuss alternate living arrangements for you or them as needed. Please use a separate bathroom. If this is not possible, clean anything you may touch in the bathroom after every use. And this includes faucets and handles. All the bathrooms should have a working sink, soap, and paper towels. Please do not use cloth towels and never share towels with others. And for more information, you can consult a CDC website. If you have a browser, you can search CDC coronavirus prevent getting sick, and that will likely direct you to an excellent resource on how to protect others from falling ill. Please also stay 6 feet away from others and wear a face mask if you are around them. Ideally, there should be a door that always separates you from others. Sleep in a private room with your door closed. Use the inside of your elbow to cover your coughs and sneezes, and please throw away used tissues immediately. Wash your hands often with soap and water for 20 seconds. If there is no soap or water, please use hand sanitizer with at least 60% alcohol concentration. Have food prepared by others and delivered to your door. And please use disposable eating utensils if possible. Please bag any garbage and leave it outside your door for pickup. It can be placed in a regular trash bin. And please have someone else take care of your pets if possible, if you have any. And you may need to have someone else do your laundry. And if they are, please let them know that they should be wearing gloves if they're handling your laundry. And if they don't have access to gloves or any other barriers, please make sure that they wash their hands or sanitize their hands afterwards. It's also a good idea to not shake any dirty laundry. This will minimize the possibility of dispersing viral particles through the air. Please launder items as appropriate in accordance with the manufacturer's instructions. If possible, please launder items using the warmest appropriate water setting for the items and dry items quickly. Dirty laundry from an ill person can be washed with other people's items. Please clean and disinfect closed hampers in accordance to guidance for surfaces. If possible, please consider hanging a bag liner that is either disposable or can be washed. And please prohibit visitors who do not have an essential need to be in your home. You are allowed to walk outside of your house on your property, but you should remain at minimum 6 feet away from others and wear a mask. You should not leave your property, home, or apartment except if you need to get medical care. And of course, please do not visit any public areas. Do you have any questions about what we just covered?
No, thank you.
Yep, okay. So I guess, would you be able to describe to me your current living situation? What type of residence do you reside in?
A house.
Okay, so along the lines of a single family home?
Yes, yeah.
Okay, thank you. And including yourself, how many people live in this house?
Two. There are two of us, myself and my husband.
Okay. And do you feel that you're able to isolate yourself at home away from your husband until your symptoms clear up?
Yes.
Okay. And just to verify that this location that you will be isolating at is the same as your permanent address, 152 Astor Drive in Horseheads, New York.
Yes, that's correct.
Okay. And do you have a private bathroom that can be used by just you yourself? And if not, do you have a bathroom that you can immediately clean before and after each use?
No, I've got a bathroom downstairs that I'm using. Yeah, private bathroom.
Okay, perfect. And do you need any additional help with food or any other medical supplies, mental health, or any social services in order to successfully self-isolate for at least 10 days?
No.
Okay. So next I have a couple of questions about your background, I suppose. First, I'd like to ask for a general description of your occupation.
Yeah, I'm a physician, a radiologist.
Okay. And I'm assuming that you have nothing else, you don't work part-time or do anything else on the side?
No, that's my only
Profession. Okay.
occupation. Yeah.
Okay, physician, thank you. And so I might have a few questions about that later down the line. But also, for this condition, for COVID, would you have been hospitalized?
No.
Okay. And as of right now, are you currently at home?
Yes.
Okay. So next, I have a series of questions about your medical history. I will start off by going down a rather extensive list of symptoms tied and often attributed to COVID infection. Please stop me if I cover a symptom you have experienced or are currently experiencing, or let me know, of course, if you want me to repeat any of them. So I will start going, and please cut me off when I hit something that applies. So,
Okay.
Have you recently had any of the following symptoms? Fever, chills.
Yeah.
Oh, okay, fever. And was that measured, or was that just, did you feel feverish?
I took my temperature, yeah.
Okay. And would you happen to recall how high your temperature got?
Yeah, I think the highest was about 101.
Okay. Thank you. And any chills, rigors, muscle aches, headache, back pain, fatigue, runny nose?
Fatigue, I was a little tired.
Okay,
I'm tired.
fatigue, thank you.
And runny nose,
Fatigue.
actually.
Okay, thank you. Congestion, sore throat, loss of smell?
I had a bit of a sore throat.
Okay, sore throat. Loss of smell, loss of taste, shortness of breath, difficulty breathing, wheezing, chest pain, cough, abdominal pain, nausea, vomiting.
I think I did have a little bit of a cough. A few days back, I was coughing.
Okay. Abdominal pain, nausea, vomiting, diarrhea, dehydration, confusion or altered mental status, seizures, or anything else that typically is something that you would not experience that could possibly be attributed to COVID?
No, that was it.
Okay, thank you. So of the symptoms that you had, the fever, fatigue, runny nose, sore throat, and cough, when did your first symptom begin?
I think it was on Sunday. Yes, it was the 15th.
Okay, thank you. So Sunday the 15th was when you first became symptomatic. And as of today, are you still symptomatic? Are you still feeling ill?
I'm feeling a lot better, but the fever's gone, but I still have a bit of a runny nose, a little bit of congestion.
Okay. And did you develop pneumonia that you know of?
No.
Okay. And did you experience ARDS or acute respiratory distress syndrome?
No.
And did you have an abnormal chest X-ray?
No, I didn't have a chest X-ray. No.
Okay. And did you have any other diagnosis for your illness?
No.
Okay. And did you have an abnormal EKG?
No.
Okay. And do you have, as far as you know, are you immunosuppressed? So for example, do you have a history of cancer treatment, bone marrow or organ transplantation,
No.
any immune deficiencies? Okay.
No.
And I know that you're a physician, so I won't explain all that. And to the best of your knowledge, are you currently pregnant?
No, I am not.
Okay. And so next I have a list of possible pre-existing medical conditions. Like the symptoms that we went through above, please let me know if I hit anything that does apply to you, or let me know if you would like anything repeated. So I'm going to get started. Diabetes type 1 or type 2, cardiovascular disease or serious heart condition, chronic renal disease, chronic liver disease, current or former smoker, neurological or neurodevelopmental condition, hypertension, coronary artery disease.
Yes, I've got hypertension.
Okay. Okay. Coronary artery disease, obesity, dementia, thyroid
Yes, I've got that one. Obesity.
Okay. Dementia, thyroid disorders, dialysis, stroke, high cholesterol, chronic lung disease such as emphysema or COPD, moderate to severe asthma, any asthma, severe obesity where BMI is greater than or equal to 40, history of substance abuse or misuse, any psychological or psychiatric conditions, autoimmune conditions, any other uncontrolled or underlying medical conditions not mentioned, or do you have anything else that comes to mind that I have not covered?
No, I think that's it.
Okay, so just I have noted obesity and hypertension. Thank you. Would you happen to be familiar with the COVID Alert New York Proximity app?
Yes, I have it, yeah.
Okay. And do you have you have the app downloaded on your phone? That's fantastic.
I do. Yeah.
Yep. Okay. And did you get tested because you received an exposure notification through the COVID Alert New York Proximity app?
No, I got tested because I was starting to feel sick.
Okay. And would you please help stop the spread of COVID-19 by sharing the anonymous close contact codes the app collected from other app users who came close to you? This would allow the app to send an alert to these individuals. I also want to emphasize that the app will never reveal who you are. The codes are shared in a secure, private way.
Sure, yes.
Thank you. And please open the COVID Alert New York app and click on My COVID Alerts at the bottom of the screen. And when you've done that, please then click What to Do if you test positive, and then click Share Your Close Contact Codes. I will now provide you with a 6-digit number to enter into the app. I can either send you the number through text message, or I can read it to you over the phone. And do you have a preference for?
Yeah, could you just text it to me?
Yep, that sounds good. And just to verify, that text will be sent to area code 334-523-4467.
Yes, that's correct.
Okay, thank you. And so now I'm going to generate a code. So the code will now be sent to your mobile number. And once you receive it, please enter your 6-digit number into the app, click Next, and then click Share when asked if you want to share random IDs. And I also just want to thank you for participating in the COVID Alert New York Proximity Exposure Notification Program. And thank you for doing your part to help stopping the spread of COVID-19 in New York State and the country.
Yeah, of course.
Okay, so next I have a couple of questions regarding your exposures. And what I mean by that is I'm trying to get a sense of where you were the 14 days before you became sick. So for reference, if you happen to have a calendar on hand, that would be helpful. That might help jog your memory. But the window that I'm really trying to pinpoint in on here is between November 1st through November 15th. So these are the 14 days before your symptoms manifested. And this is
Okay.
going to help us determine where you may have been exposed to COVID. And I also want to emphasize again that this is kept purely confidential and that we do not release your name to anyone. So that said, in the past 14 days between the 1st and 15th of November, have you been in contact with a COVID-19 case that you know of?
No.
Okay. And again, within the 2 weeks prior to symptom onset, did you travel to or live in another country?
No.
Okay. What about travel or did you live in another state?
No.
Okay. And did you travel or live in another county outside of Chemung?
No.
Okay. And did you travel on a cruise ship or vessel as a passenger or crew member?
No.
Okay. And did you travel on a plane, or even if you didn't fly, would you have happened to have visited any airports, maybe to drop
No.
someone off? Okay. And did you have any direct contact with any type of animal?
No.
Thank you. So next, I have a list of sensitive settings that you may have visited in the 14 days before your symptoms began. So again, the window that I'm asking about is between November 1st and November 15th. Please let me know if you do recall visiting any of these locations or settings, or if you'd like me to repeat anything, and I will start going through a list and let me know. Did you visit or attend in the 14 days before symptoms began an adult congregate living facility, a school, university, or child care center, an animal with confirmed or suspected COVID-19, correctional facilities, an indoor mall, a store or retail location?
Yeah, I did go out and shop in that period of time.
Okay. And would you be able to give or provide me with the name and maybe the details about the store or its location?
Yeah, I went to the Aldi's in Horseheads. It's off of Route 86.
Okay, thank you. And did you visit or did you go to any outdoor or indoor restaurant or bar, hair salon or personal care provider, any gyms to exercise or work out, or a gym or fitness studio for any type of indoor group fitness class, place of worship, casino, movie theater, museum or gallery, a zoo or aquarium, bowling alley or arcade, any indoor or outdoor social or community events, any indoor or outdoor live performances such as a theater or a comedy club, any sporting events or any other type of community event or mass gathering, workplaces, or any other exposures come to mind?
Well, I do. I go into the hospital a couple of times a week. So, yeah, I did go into the workplace within those 14 days, probably a total of, I would guess, 4 times. Yeah. Let me look at my calendar. Yep.
Okay. And I would assume this is a hospital, so would you consider your workplace critical infrastructure?
Yes, definitely.
Okay. And could I have the name of the hospital?
Sure. It's Arnott Health.
Okay. And I just want to verify that's spelled A-R-N-O-T, Arnott Health?
Yes, that's correct.
Okay. Thank you. Okay. And would you happen to know off the top of your head where that's located? Is that Chemung County?
That's in Chemung County, yeah, 600 Rose Avenue.
Okay. Thank you. So next I have a few questions about your activities. I'm going to be asking you about what you did in the 2 days before your symptoms began. What I'm really trying to get here is a good sense of your life between the day that you first began feeling ill, so between Sunday the 15th and Friday the 13th. So ideally, what I would like to ask you to do is walk me through your life from the moment you woke up on Friday morning on the 13th of November, and walk me through Friday, all of Saturday, and all of Sunday until you began to feel ill or off.
Yeah.
And if it helps,
okay.
If you have a calendar or any notes, any emails, anything that would help jog your memory, that would be excellent here, because I'm really trying to pinpoint where you would have been and who you would have been with in that 2-day infectious period.
Yeah. So on that Friday the 13th, I actually did go into the hospital. But, I'm a radiologist. I was in my office that day, regular 9 to 5. But I did have lunch with a colleague. So he's really the only person that I had contact that I was, with for over 10 minutes or so.
And for that lunch, was that at work, or would you have left the premises to go out for lunch?
No, we had lunch in my office.
Okay, thank you. And anything else from Friday?
No, after work Friday, I went home. My husband was at home, but we didn't go anywhere. And then the weekend, really, Saturday and Sunday, we were both home and started feeling sick. I'd say Sunday afternoon.
Okay. Thank you. And, if we do run through the course of the interview and anything else comes to mind, please, feel free to let me know, and we can always come back to this topic. So this, I'm sorry, when you would have gone into work on Friday the 13th, would you have taken public transit, or would you have driven a personal automobile or walked?
I drove in my own car. Yeah, I drove there in my own car by myself.
Okay, thank you. And this hospital that you mentioned, Arnott Health, this healthcare facility, I just want to make sure that I have that here. That is Arnott Ogden Medical Center, located on 600 Rowe Avenue in Elmira, New York. Yeah. Okay, thank you. And aside from Arnott Medical Center, do you work at any other healthcare facilities, or is that the only one?
That's the only one.
Okay, thank you. And would you be permissible in having us send you your isolation order through email as opposed to sending it through traditional mail? And,
yeah, that's fine.
Okay, perfect. And I just want to verify your preferred email as what we had recorded before, jthomas4@gmail.com.
That's correct.
Okay, thank you. And so I guess next what I want to move on to is I want to get a sense of who you would have had contact with in the 48 hours before your symptoms began. And I know that you had mentioned that you had contact on the 13th with a colleague where you had close contact when you had lunch with them, as well as contact with your husband on Friday, Saturday, and Sunday. So Aside from these two individuals, does anyone else come to mind? Anyone else you would have had contact with in the 2 days before your symptoms began?
No, I didn't see anyone else have contact with anyone else during that period of time.
Okay. And in just a moment, I would like to gather a little bit of information about your spouse, Kevin, and your colleague, your work colleague. So you indicated having a total of 2 occupants in your household, yourself and your husband, your spouse, and 2 close contacts total. So let's start with Kevin, your husband. So his name was Kevin Thomas. And I apologize, could I have his cell phone number again, the best way to reach him?
Sure, yep. Yeah, it's 907-663-5690.
Okay, thank you. And his email address, if you happen to know off the top of your head.
Sure. Yep, it's kjt605@gmail.com.
Okay, and I'm going to read these both back to you. His cell phone number is 907-663-5690, and his email I have as K as in Kevin, J as in Janice, T as in Thomas, 605@gmail.com.
Yes, that's correct.
Okay. And could I have your spouse's date of birth?
Sure. It's 3/2/76.
Okay. And what gender your husband would it identify as?
Male?
Okay. And he is family. Household contact. And would you say that your husband's preferred language is English?
Yes.
Or anything? Okay. And I'm assuming his address is the same as you, 152 Astor Drive, Horseheads. Okay. And to the best of your knowledge, is your husband, is he immunosuppressed in any way?
No.
Okay. And is your husband symptomatic?
No, he is not. I hope he stays that way.
Yep, I do too. Could you describe your husband's occupation?
He's a high school teacher, teaching remotely.
Okay. And could you share with me, and again, everything we do ask is kept confidential, where he teaches, what school he teaches at?
Sure, it's Wood Lane High School in Horseheads.
Thank you. And what was the last day you would have had contact with Kevin?
You know, when the day that I decided to get tested, that was when we decided to be careful because we were suspecting COVID. So that was the 18th.
Okay, thank you. So next, you had mentioned a work colleague who you had had contact with over lunch on the 13th. Could I have their first and last name?
Yes, Dennis Frank.
And the best way to reach him, a phone number?
607-737-4961.
And would you happen to know of an email address? If not, don't worry about it.
I don't have his email.
Okay, yep, that's fine. So that was Dennis Frank, 607-737-4961.
That's right.
Thank you. And do you happen to know his date of birth?
I don't, but I know how old he is. He's 41.
Okay. Okay, thank you. And what gender would Dennis Frank identify as?
As male.
And relationship to you would be a colleague, a coworker. Type of contact was, of course, in a workplace setting. And Would you say that Dennis's preferred language is English?
Yes, it is.
Okay. And would you happen to know Dennis's address? And if you don't happen to know the specific address, just the city or possibly a county?
Yeah, he lives in Elmira, but I don't know his address.
Yep, that is perfectly fine. Thank you very much. And do you happen to know if Dennis is immunocompromised or immunosuppressed in any way?
No, I'm pretty sure he's not. I'd say no.
Okay. And to the best of your knowledge, is Dennis symptomatic?
No.
Okay. And is he also a radiologist?
Yes.
Or physician? Okay.
Yeah.
And I'm assuming he also practices at Arnott Health.
Yes.
Okay. Thank you. And just to confirm, the last day you had contact with Dennis, Frank, was on Friday, November 13th.
Yes.
About a week ago. Okay. Thank you. Do you happen to know if Dennis has been, or anything else, does anything else come to mind for Dennis? Anything else that you want to make note of, or is that about it?
Well, I'm realizing that I probably should give him a call and let him know that he'll be, that he was in that window of time. So I'll reach out to him.
Okay, thank you so much. So thank you for sharing your information on your close contacts. New York State Department of Health has a new mobile application called Share My Contacts, which would allow you to securely and anonymously report any close contacts not shared during this interview. So for example, if you were to remember or recall anyone after we hang up the phone, we can provide you with a link to this mobile survey where you can enter the names and phone numbers of any additional contacts you were to think of after we get off the phone. And if you are amenable to that, would you like for me to send you the link to that survey through text message?
Sure, you could send it.
Okay, thank you. And again, I just want to verify that number is 334-523-4467.
That's correct.
Okay, excellent. So I'm going to send that. And again, you will have up to 2 days to add any contacts that you happen to think of that you would have had close contact with in the 2 days before your symptoms began. So you should receive a text for that within the next 15 minutes. And thank you so much for agreeing to participate in contact tracing. So the way this is going to work is, of course, before we end, feel free to ask me any questions, but going forward, you will likely receive a daily check-in from the county health department, from Chemung County Health Department. And what they're going to be doing is they're going to be looking to see that you're doing okay, that you don't have any urgent or newly developed needs. And they'll also be checking on your symptoms to see how you're feeling and if you're getting better or worse. And once you meet the criteria to be released from isolation, they will, of course, send you a release from isolation order through email. And if you do have any questions during that time frame, that daily checkup is a fantastic opportunity to ask and get any details about what you might be interested in knowing. And that said, do you have any questions for me? Any concerns that you'd like to voice?
Thank you very much. No questions.
Okay, I think we are all set. Thank you so much. I hope you feel better soon, and I hope you and your family stay happy and healthy, and take care. Have a great day.
Thank you. You too. Bye.
Yep. Bye. Okay, so that was a demonstration of a more typical case investigation interview with an adult case. So here, we've gone through the whole process of obtaining information, making ourselves, definitely try to be understanding. Some people are a little bit might be taken aback by the current circumstance. So, being emphatic and conveying that you understand how they're feeling is a key part in getting, the best information that you can get from someone. That said, once we have completed this interview and once we've added all the contacts that we are able to get at the time, what we want to do now is, as I mentioned, we want to add a new note. And here you will see a field populate once I've clicked this checkbox under patient notes. And what you would want to do in this scenario is transfer over any notes that you took through the course of the interview. I'm of course not. What I would recommend is you type in type your notes in a fashion that makes sense and is clear to the county health department. You do not need to label your note with a timestamp or your name. That is done automatically. So any information from your case investigation interview that you feel is relevant or important, please note that. Also, please note that if you do reach the case, you should update any disposition fields by clicking on case details, view update the rest of the case's information, and please update this from no attempt made yet to reached person agreed to call, because we have now completed the interview. And so again, just to recap, we've added any notes that we took, but of course summarized in a better manner than I have here. And we have clicked on update the case's information and added that their disposition is now reached and agreed to call. And once this is all filled out, what we want to do is go all the way down and make sure that we submit these updates. So now we have a note and we have updated their disposition and submitted this information. What we want to do next is unassign Jennifer Thomas from ourselves, because as part of the case investigation surge team, we are only conducting the initial interview. We are not doing the daily follow-ups. So in order to do
and then I guess I'll just jump in, Ethan, that maybe before you unassign, you can also just do a walkthrough. Sort of now you're off the phone, it's a little, you have more time, you can look through to make sure that you didn't miss anything, you checked all the right boxes. It's nice to do that, just a once through.
Yep, definitely do that. From experience, I do make mistakes now and then, so thank you so much for pointing that out. Please do go through the case investigation form, and while everything is still fresh in your mind and while you have the notes in front of you, definitely a great idea to, again, click on view update the rest of the case's information and go through to make sure that everything you have entered is accurate. So I would give everything a once over. I'm going to scroll rather quickly down through the interview. And not seeing anything that looks outrageously wrong, I'm going to hit submit at the bottom of the form. And you will see now that once this is submitted, I'll show you how to unassign the case from yourself so that the county is aware and that they will take over, so that they take over the daily monitoring. So if you click on My Cases and you select the case themselves, so here, Jennifer Thomas, what we want to do is click on Continue. Then we want to click on Assign or Reassign the case and click on Permanently Unassign the case from its current owner. So the first option here, and then click Submit. And once that is done, you will see that you are no longer going to have them appear under My Cases, and they're now going to fall under All Cases, and the county will take over the daily monitoring process from here on out until they are deemed to have fulfilled the release from isolation criteria, at which point, again, the county would follow up with them. So I think that is it, unless there's anything else that I have missed. Anything come to
No,
mind?
that's
Ariel?
great. No, I think
Okay.
it's terrific. Thanks.
Okay. All right. Well, thank you so much. Thank you so much for your time, and thank you so much for everyone that might be watching this. And if you have any questions or anything, please reach out to the RIST support BML team. And thank you for your time. Take care.